Hi, welcome to Pennsylvania Newsmakers, and thanks for watching. Well, first of all, happy holidays to you and all your loved ones, and may this time of year bring a lot of peace and joy into your homes. Healthcare update, very important. Plus, we're going to have Pennsylvania's new environmental czar on the program. All of that and more following these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Well, we're going to have a very important healthcare update. The recession is hit. How deep it gets, no one knows for sure. But joining me, as often is the case, is Carolyn Scanlan. She's sitting right across the table from me. She's the president and CEO of the Hospital and Healthsystem Association of Pennsylvania. Carolyn, welcome.
Thank you.
Happy holidays, Merry Christmas, Happy Hanukkah to everybody out there. Good to see you, and you're festive. You got red on.
Red.
Well, I have dark, but we'll get into the real subject matter. Look, over the years, we've had a lot of opportunities to talk about healthcare. Talked about access to your institutions. We've talked about medical care in general, something you're a real authority on. But I tell you, I don't think we've ever had an economy that is slipping the way this is. What kind of general reaction do you think the healthcare system is seeing to this recession?
Well, it's twofold. One is from the community and the patients themselves, and the other is as the organizations run themselves. You know that we've talked a lot about how hospitals need to update themselves, the technology, their information systems, their buildings. Right. And the same way that it's difficult for other businesses to borrow money, it is difficult for hospitals to borrow money. It's more expensive to borrow, and hospitals, like others, including individuals, have investments, and so they don't have that investment income also.
Yeah, I want to stop you here because I don't think that's something that a lot of people think about, this credit crunch. And, you know, hospitals, some buildings like college campuses where we're updating, you know, putting new buildings up, renovating old ones. You can't just function with buildings that are 50 and 60 years, getting the money to do that. And then you have the added problem of the technology, right?
Exactly, and technology changes. You know, healthcare technology is changing all the time. And so borrowing the money or having it yourself or having people contribute money through philanthropy is all significantly impacted by this recession. And so we are seeing hospitals delaying projects that aren't already under contract or underway. And I think we'll see a little a slowdown. In some instances, it may be significant if the hospital started with an uncertain financial status.
Let me ask you a question about individuals. I mean, as people, Pennsylvania, as you know better than anyone, has a pretty high rate of folks who have health care coverage. We have one of the highest rates in the nation. But doctors' offices and hospitals still get people come in and don't have coverage. And do you think that's going to worsen now? Is there going to be more demands on the healthcare community to supply resources to to treat people? Put it bluntly.
Yes, and in fact, we're already beginning to see that. I know we've talked about this number. Hospitals provide about $700 million worth of uncompensated care every year. That's to people who don't have insurance. Or people who have insurance with large deductibles and co-pays. And what we're seeing is people losing their jobs and therefore their insurance, or having insurance policies which far larger deductibles and co-pays. And so people do not have the ability to pay, and hospitals will continue to treat them.
Yeah, one of the things that we've talked about, and I just want to get to this briefly, over the years when you've been on and along with your colleague Jim Redmond, we've talked a lot about the uninsured, and Governor Rendell has been trying several times now to get more Pennsylvanians coverage. We can argue about the number covered. We can argue about the number, let's say 800,000, that's the total. But do you really think, isn't this something that maybe with the new Obama administration, that universal health care, it always seemed to me, seems more of a national. And we shouldn't have to rely on the states with their limited resources. Are you looking towards, President-elect Obama, who made a big deal of this, as an architect to come up with some plan that Congress will approve?
There's no question that we are, and his appointment last week, his official public appointment, of Secretary of HHS, Health and Human Services, Daschle,
Right. Tom Daschle.
And who is also going to hold a dual title
Right.
as the head of his Office for Healthcare Reform,
Right.
signals to us that they are serious about moving ahead with a program for the uninsured. And we really believe that that is the place that it should occur and will help us as a state.
I just didn't know how states, in good times, states still have to use unusual financial methods, taxing businesses or forcing people without, who don't provide coverage, business community to do it. And, that's debatable whether that's the right approach, whether it should be shared more generally by lots of folks in our society. But now in a recession,
it's hard. In the state government, particularly in Pennsylvania, and I think it's all of the states, we have to have a balanced budget.
Yeah.
Now, we can debate whether at the federal level we should have a balanced budget, but they aren't constitutionally obligated to do that, and so have more ways of setting up a financing mechanism for a program for the uninsured than a state like Pennsylvania does.
All right, we're going to take a quick break. I want to come back. We're going to talk more about Pennsylvania Focus Healthcare after these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business. This broadcast of Pennsylvania Newsmakers is presented by Pennsylvania Medical Society. Doctors and patients, preserve the relationship. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back, and again, happy holidays. We're talking with Carolyn Scanlan. She's the president and CEO of the Hospital and Healthsystem Association about important health care matters. Carolyn's one of our experts. She comes on from time to time and helps us understand these issues better. Carolyn, let's talk a little bit. Governor Rendell has been trying this. I think we're now kind of on the third iteration of a program. He says he's coming back. We'll see in a recession if he is. How should Pennsylvania sort of deal with the problem? What's your sense about how our state should deal with the whole issue of access?
Well, access is twofold. Mm-hmm. It's probably more than twofold, but for purposes of today, it's having insurance so that you have a way to pay for the care, but it's also having a physician and other healthcare providers available when you need them. Right. It doesn't help you to have insurance if you do not have a physician or a hospital to go to. And so our concern has been to make sure that we have physicians in this state.
Right.
And as you know, the debate in this last legislative session was tying a program of the uninsured to supporting physicians in how they pay for their liability insurance. And as a result, we hit an impasse. But our concerns have always been to make sure that we have enough physicians in this state. Right. There is going to be a national shortage of physicians. And we, Pennsylvania, will be competing with other states for physicians being trained and coming out of schools and other programs. And so we need to make Pennsylvania physician-friendly.
And for our viewers, we have some of the best teaching hospitals, training facilities in the world. Is that in our state?
We do. We have
right?
6 academic medical centers. But we're finding world class. But what we're finding are when the students finish, less and less of them are staying in Pennsylvania to actually practice.
Right.
So they come to our world class facilities to get trained and then go to other states and other places to actually take care of patients. We have to change that trend, and we have to keep those students who ultimately graduate and become physicians in Pennsylvania. And one of the ways to do that is to make the physician community feel that the state and the community as a whole is supporting them.
And we tend to think of this, this is just not a problem that you get in the suburbs or in the cities, but it's a huge problem in a state that's we're large geographically, huge rural population. Folks have told me that if you live in a rural part of Pennsylvania, you could, have to drive an hour and a half to get to some of the specialists that we take for granted in the communities in which some of us live, right?
And one of the basics is just getting obstetrical care for pregnant women and then the pediatric care for their children. We do have a shortage in our rural areas, but it's a shortage regardless of where you are in the state. And we really need to work hard going forward. And we have made it a priority to work with our hospitals to work with state government and other policymakers to encourage physicians to stay in Pennsylvania.
Do you think that one of the concerns I think that a lot of folks would have would be that if this recession deepens, that there are actually some hospitals that will merge, not so much that they'll merge with another hospital, but they might literally cease to function in some rural areas. Is that a possibility?
It is. We have, from the data that gets published every year, there are a series or a group of smaller hospitals that struggle financially and have just make it by each year. This recession could actually cause them to have to close or transform themselves into something else, or as you started, to maybe be bought by something. But every community in those rural areas, generally the major employer is the hospital. So you would have sort of a death spiral for the whole community if a hospital had to significantly downsize or close.
Yeah, that's a good point. I mean, one of the things that I found, I mean, as you know, spent most of my life in education, and we've got 130 or so colleges and universities, many of them in small communities. So you might have a education institution and a hospital.
Those two.
Yeah, the big employers, and if they leave, I mean, you got all sorts of problems. Education, you all need if we're going to have physicians, they've got to get educated.
They have to be educated, and you know, we start by saying that Pennsylvania wants to attract businesses to the state. Well, one of the things that businesses look for are good educational systems and good health care, which means good hospitals.
All right, we're out of time. Look, great update. We'll have you back because I think there's a lot more implications to all of this that we're going to have to deal with in the new year. All right, when we come back, the state's new environmental czar, is that what I want to call him? He's been on the program many times, and he's back, and I'll tell you who after this break.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. And joining me, as often is the case, is John Hanger. He is now the Secretary of the Pennsylvania Department of Environmental Resources. You'll remember he was on the show very often as the President and CEO. Were you President and CEO? The head of Penn Future, the state's leading environmental organization. I always get into trouble by saying that anyway, but that's okay. Mr. Secretary, welcome.
Thank you.
Now look, let's get into it. We got a couple of important things to talk about today. First of all, we had some folks on, we did some programming on not a new, but an energy source connected with this shale formation known as Marcellus Shale. It covers a wide reach of Pennsylvania, mostly up in the northeast, and swings around through the western part of the state. You get natural gas from that formation. There's pluses and there's minuses, so let's talk a little bit about it. New energy source, that's obviously the plus.
And it's a huge energy source. There's about enough natural gas under two-thirds of Pennsylvania to power the entire country for 12 years.
Wow, that is stunning, isn't it?
It is a wow, and it is stunning.
Yeah. Now, Pennsylvania actually imports natural gas, correct?
We have been up to this point. Historically, we've had about 25% of our natural gas needs produced here in the state. But this Marcellus Shale gas is going to completely change that. we will produce more than enough gas for our own needs, and we'll be exporting.
Mm-hmm. So in other words, when the production is finished and we now get a supply from it, we'll supply our own needs in this state and then we'll export it to other states. Is that the point?
Well, we'll produce enough gas here to supply our own needs. And the way the markets work, what you produce locally doesn't always stay local. Obviously, the owners of the gas will take the gas to the marketplace, and they are looking for the highest bidder. So I don't want to say all the gas produced here is going to stay here.
That's a great point. Now, there are obviously, and let's be clear, there are environmental concerns. I mean, everybody wants energy, but it has to be clean energy. It has to be safe. I think all of us would agree to that. Let's now, big energy source, important energy source. It can change, the nature of energy production in the United States, or certainly the supply, not the production. Talk a little bit about some of the concerns that have to be met in order to reap the benefits from this this energy source.
Well, the source is so big, and the drilling that will occur here is going to be, there'll be so much of it, and the size of the drilling rigs are much bigger, that there are big water issues that we have to pay attention to. There's a lot of water that has to be withdrawn from either rivers or streams or other sources. We're trying to encourage withdrawing from mine pools and some of the degraded water we have. So there's a water withdrawal issue because the drilling takes a lot of water. And then when the water comes back up out of the drill hole, we have to dispose of it. And the water, when it comes back up, unfortunately, is heavily polluted. And we have to, in fact, make sure that wastewater is not fouling our rivers and streams and contaminating our drinking water. And by the way, other businesses need water at a certain quality in order to do their business.
So is that part of the process expensive, time-consuming, technologically a problem? What or all three?
Well, in Texas and some other places where they've done this kind of drilling for a long time, they inject the wastewater underground, or they put it in holding ponds and let the Texas sun evaporate the water. Now, we can't actually do that here because of our climate.
Right.
We are looking for places to inject the water underground. And then there are certain treatment options that are available, though expensive. This is an issue that we're, in fact, formulating policy on right now.
Right. Okay, we're going to take a quick break. When we come back, I want to talk about the energy investment funds. Pretty important. Stay with us. Back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is presented by Penn Future, where we believe that every environmental victory grows the economy, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania.
Hi, welcome back to the program with John Hanger. He is the Secretary of the Pennsylvania Department of Environmental Resources. Mr. Secretary, let's talk a little bit about this alternative energy investment fund. We know how important investing in environmentally friendly energy production. Is that a way to put it?
Sure.
What is the fund and why should our viewers care about it?
It's $650 million. It was made available by the legislature in July. Most of the money is going to come from the issuance of bonds. We expect that those bonds will be issued in either the end of the first quarter of 2009 or the second quarter of 2009, so somewhere between March and June of 2009. It's a real opportunity to give the economy a shot in the arm, very frankly. I don't think it was passed.
I was just going to say, I think that could be really helpful given the fact that we have to increase demand, as you know. Go ahead.
Absolutely. And the money is going to be put into solar, wind, energy conservation, and other alternative energy projects. These projects are going to create thousands of jobs during the construction phase, and I think also we have a good shot at getting some permanent jobs, some companies to locate here. So the timing of this fund is actually very good.
Now, would companies apply? How just sort of, you don't have to get into the details of it, but the overview of, can companies apply for this?
Well, in terms of
going to work?
In terms of the solar program, there's going to be a residential component, so individual homeowners. We're going to, for the first time, have a large residential solar program in Pennsylvania, and a lot of excitement about that, and I think we'll have the guidelines and the application rules out in early 2009 for that, and then when the money is available, we'll be able to hit the ground running on that. And then in terms of the larger projects and sort of trying to bring to Pennsylvania new companies, they would go through an application process and work with the existing development agencies in the state.
So in other words, there's a component for both the those of us who are like average consumers, and then for the businesses to go through. Now, does that procedure work through your department?
Some of it will be administered by the Department of Environmental Protection. We're doing the homeowner part, and I'm really excited about that. And then the business part is going to be done by the Commonwealth Financing Authority and also the Department of Community and Economic Development. Yeah,
I'm sure. I mean, I think that's one subject that will be tremendous interest. And before we go, I want to ask you about, this turn down, seal off, save up, for, in a minute or so that we have left. This is a good point. We're getting into winter now. The weather has already turned. Saving electric, gas, and what we do within our homes. Too many people just let that go. What should folks be doing now?
Well, it's good for, regardless of your economic circumstances, to use energy wisely, and you actually can save money by doing it. And you can set your thermostat at 68 degrees during the day, or even a little bit lower, turn it down to 60 degrees at night. Now, we've got some hard times here, and we've got some families that are actually not able to fully pay their utility bill. And
that's the LIHEAP. They get go ahead.
Yes, there's the Low-Income Home Energy Assistance Program.
And we've done programming on that.
And yes, and that's a very, very important program. But also these consumer tips, like setting the thermostat, like making sure that you are sensible with how you use your lights and other energy within a home, is a way to cut your bill and make it more affordable.
By the way, we're doing that at Franklin Marshall College. I want to have you know that one of the ways, well, we're doing it for two good reasons. I think, one, it brings down costs, and two, we all have a responsibility to do what we can to save energy, right?
And absolutely. You protect your pocketbook and protect the environment by saving energy.
Yeah. Well, look, as always, I want to thank you. When you get those guidelines up, I want you to come back, because that's, I think, important for the average consumer to have a chance to...
In January.
In January?
Yep.
You'll come back and we'll talk about that. All right, thanks for watching, and guess what? You all have a great New Year, because we expect to here. Things will get better in the economy, and as always, stay well.